Hi, this is Dr. Luke at Clearsight LASIK, and here we are doing a SMILE LASIK or small incision LASIK procedure. The first thing we're doing is docking. We do this on the patient's visual axis, which tends to be toward the nose and toward the bottom. Now we are applying the laser pattern, first posterior or back, and now front or anterior. And then we make a very small opening from which we are going to remove the patient's prescription. We then move the patient back toward the second microscope, and this is where we remove the patient's prescription. I hold the patient's eye with my left hand, and with the right hand, I dissect or open up the two planes. This is the front plane, and now this is the back or the posterior plane. And the patient is not feeling anything but a small amount of pressure. There goes the patient's prescription. We now distend the cap or the front part of the eye. We just stretch it out to make sure that there are no wrinkles. And the patient is no longer nearsighted and already seeing better than when they walked in. Congratulations to this patient.